we have Maura here again with us from our first video. We just loved how we were able to get so much information and knowledge from her. So we just want to talk about today our different experiences working in the ICU. Maura actually works in the peri-op area, which involves pre-op or and PACU. So we would ask her to just give us a little bit more detail about her experience working there, what her workflow is, and just basically her day-to-day life as a nurse in these areas.
Well, so I work pre-op, and whenever I work pre-op, a lot of the nurses like to do 410s. I still do 12s because I got used to only working 3 days a week, and I enjoy having my 4 days off. But start time for that is very early. It's 5 a.m. We come in at 5, and we usually have 2 start patients. So you start with your 2 patients, and you get ready for OR, and you hold them until the surgeons are ready to take them back. Pre-op, I would say you're generally done sooner than you normally would be in any other nursing field, because basically once you've pre-oped all your patients, you're literally done. Like, you don't have anything else to do for the rest of your shift. Usually we stay a little longer because there always can be add-on cases or emergency cases, but literally once you're done, you're done. Then in terms of PACU, I usually start at 7:30 or 8 o'clock. I just pull 12s. They stagger our arrivals just so we have people who come in very early, and then we have people who are there late, and then we also have on-call. So we have night shift people, but then every single nurse is required to have an on-call week and an on-call weekend. And during that week, basically, if your phone rings and there's an emergency case or they need more staff, you have to come in. But it's only literally 1 week, I think, every 6 months. So it's not like that's a continuous expectation. Whereas I know in the OR, they're required to be on call 3 days out of the week. So that can be outside of the 3 days you work too. So you could potentially have 6 days you have to work. So I don't know. I think there's more of a work-life balance by having just that 1 week every couple of months that you're required to be on call. Mm-hmm. But in PACU, we have a patient ratio of 1-to-1, or it's 2-to-1 if you're holding a patient. And by holding, I mean you're just waiting for them to get a bed available in the hospital. We have both critical care patients we take care of, so ICU level, we have PCU level, and then we have patients we'll send home directly post-surgery. And I don't know, I really like that variation in level of care. I still get my critical care hours, so I can still do my CCRN license and stuff like that. But then also at the same time, there are times where if you were overwhelmed from your last patient, your next one will be a walkie-talkie, and you're like, okay, you're easy. Like, I don't have to worry about you. I know you're going to be fine. And I also just like the variety I see. We get things from just people coming in to have their parathyroid removed to full-on open AAA surgery in cabbage patients. So yeah, I don't know. I really like it. You work directly with surgeons and anesthesia, which speaking from experience and working on the floor in an ICU and in PCU, you get responses much faster. And they definitely, in comparison to my experience on PCU, I think they trust the nurse's opinion a little bit more. And you have an order set, but from your order set, we're allowed to make decisions based on what we're seeing, if that makes sense. So I think there's a little more autonomy for nurses in the PACU as well. But yeah, I really like it. Highly recommend.
If you want to tell, because I'm sure some people watching these videos are not maybe in the medical field. Some of them are trying to get into nursing. Some of them are not even nurses, or they're nurses back somewhere in another country. You want to tell them what PACU means?
Post anesthesia care unit. Right. So I take care of patients right after they've had cardiovascular surgery. And I get patients who are intubated. I get patients who have LMAs, which is just a small airway they place in the back of the throat. I get patients who come back on room air, different levels of orientation, different levels of care requirements, acuity.
Wow.
Great. How about you, Teni?
Yeah, so me, I've mostly worked in the ICU. I started in a medical ICU that was focused on COVID patients, which transitioned to a medical regular ICU that was mostly respiratory illnesses and septic shock. And then after that, I moved to a vascular ICU, which is where we take care of stroke patients and patients that have had vascular surgeries. So I do get to work with Maura's, her area. Actually, they send their vascular patients to my unit. So it is kind of in the same, I don't know, CVI, cardiovascular
Yeah,
Yeah, it's like,
CVI.
yeah, they're all kind of on the same floor and, in the same workplace. So basically, for me, I work 3 days a week, hopefully, most times. And it's 12-hour shift. I work night shift mostly. So around, I'll say 7 a.m. No, 7 p.m. to 7 a.m. My bad. As you can see, the night shift brain. So after I come in, I get two patients. Most times our ratios in the ICU is two patients, and sometimes they can be intubated. Sometimes, depending on if they're well enough, they can actually be walkie talkies, which is basically a patient that is able to walk and talk, like the name implies. So they're more independent than those who are intubated or who are really sick, who need CRT and all that, fun stuff. So for me, my patients mostly cover neural, as brain injuries, people who have had strokes, who have had like issues with their carotids, and any major vessel in the body that needs repair. That's under vascular. So I basically just come in, take care of the patients. I have to frequently assess them. With neuro patients, they can really decline. So assessment is like the number one thing on my unit. Is every hour, even every
Yeah.
30 minutes, you're
Or
going
every
in.
15.
Oh yeah,
Yeah.
PACU, they have
Depends.
to do that. I'm like, whew, it's not for me. No, because you're just gonna lose track. Like, wait, did I? So you just stay in the room basically the whole 2 hours that you have to do that Q15, I think. So yeah, we basically have to do a lot of assessments, and if there's any slight change, we have to notify the provider immediately because we have to go down for CT scan or an MRI.
Repeat
As,
CT scan.
yes,
Stroke alert.
yes,
Stroke alert.
Stroke alert.
yeah, it's like because the brain is very fragile. Once the brain is damaged, there's the chances of recovery are kind of slim. So with the brain, it's very fragile. So we do have to make sure that these patients don't decline any worse than they have to. And then for the vascular patients, they're always my best patients to take care of, as long as they don't bleed out. Because I've had a patient that bled out from their vascular site, and that was very scary for me. But if they're stable and the surgery went well, most times they end up going home the next day. Basically, all you have to do is make sure that they can eat, they don't have any nausea, their site is not bleeding, and they have pulses because you want to make sure that the surgery did not affect blood flow to the rest of their body. If you can do that, honestly, they're good to go. So vascular surgery patients, easy peasy for the most part. But yeah, that's mostly mine. Still mostly ICU patients, but the acuity is I would say it's medium level. For the neuro patients, they're pretty high. Vascular surgery patients are they're not too high acuity, at least to me. They
No,
feel like
vascular patients are easy until something goes very wrong.
yes,
And then it's not
it's not
easy.
easy. Yeah, yeah, for
Yeah.
real. It's like it's like extremes for
Yes,
vasculars.
extremes.
Yeah,
That's a good
there's
way
no
to
middle
put it.
ground for
Yep.
them. But neuro patients, except they're gonna be anticipating brain death, most times they're usually high acuity.
Mhm.
Yeah. So Jay, how about you? Can you give us your
I'm actually going
experience?
to interrupt because you were talking about night shift. PACU, we don't work nights, we don't work weekends, and you're only
Jealous.
required to be on call for one holiday a year.
So
Anyways,
jealous. So you
okay.
guys
That's
listen to Maura.
cool.
PACU is probably where you need to be.
Yeah, that's cool. I would have loved to be in the PACU, but unfortunately, I cannot because of my future career plans and all that.
CRNA.
But yeah, I'm Jay, and I'm a critical care nurse. I work in the ICU. I work in the cardiovascular ICU, the CCU for short. And critical care nurse, and I work in the cardiovascular ICU, CCU for short. And like Teni, I work 3 days a week. Except you want to pick up extra shift, but I do 3 days a week. 3 days, no cap. And I work night shifts. I work 6:45 p.m. to 7:15 a.m. on a normal day. But when you have sick patients or people coming in and things are changing really fast, I can stay a little later than that. But that's not required. But then I need to set the next nurse for success. So I work in the CCU. I see patients with STEMI, ST elevation, myocardial infarction. I see patients with some stroke patients. Stroke overflow comes to my floor sometimes. And just like a normal ICU, we have septic shock, cardiogenic shock, even alcohol withdrawal sometimes. And so I think we're also an overflow for most of the other critical patients because in the hospital, if they have a bed and they need to throw a patient somewhere, they're
Yeah.
They're
gonna throw
going
it to
there.
your floor regardless.
Yeah.
The only floor I think they don't do that is the CT, the cardiovascular, the cardiac,
Surgical.
cardiothoracic.
Yeah,
Wait,
cardio
CT.
CSICU, the
Yeah,
cardiac
cardiac surgery.
surgical ICU.
Yeah, cardiac
They're very
surgical.
specific about the patients they
Yeah.
take.
Oh yeah, they
I'd
do
rather
not.
have a
Yeah.
free bed and get a different kind of patient. So that being said, I see a lot of patients, varieties of patients, sick patients, and sometimes they're kind of like medium sick, like someone who just had a stent placed. They're fine. The only thing you have to do is, what their TR band and get the hair off it, make sure they are stable, there's no bleeding as well, and then the pulses are okay and they're doing fine. There's no repeat, you do a repeat EKG, it's fine. They're not having a repeat heart attack or something. So I see a lot of patients with that, with ST elevation for sure, for sure. And then cardiogenic shock. My patients are sometimes intubated. Yes, some of them are on Eden eye flow, room hair. So airway management is also part of working as an ICU nurse, and I do a lot of that. I would say I really enjoy my work as a cardiac ICU nurse compared to when I was a medical ICU nurse because I was always seeing GI bleed. But now having to see a lot of patients with
So
And
not like
heart
overdoses.
stuff, and if you know me for sure in nursing school, I'm really, really so fascinated about the cardiac system. It's something I've always loved. And so getting into the cardiac ICU was a dream come true for me for sure. And I really enjoy my time working in the cardiac ICU on my new floor, especially with the patient I see. I used to think that I like patient intubated, but I think I like to have conversation with them now. And so I kind of like my patient not intubated, even though sometimes you don't want to talk. You're like, I don't want to really talk today, but it kind of gives you a sense of accomplishment because some of the patients are like, thank you so much for taking care of. But if you're intubated, they can't even sometimes they can't even see what you're doing. They're unconscious because of course they're on the life support. The tube is helping them breathe and they're pretty much sedated. But when you have them talk to you, something like I'm so appreciative of the care you give to me. Thank you so much. You're a great nurse. That actually keeps me going. So sometimes I like them not intubated for that reason, just so that I have that sense of accomplishment at my job. And so I know Maura is having a lot of fun in a new place in the PACU, but for sure, working in the critical care, working in the ICU is also a nice thing to do, a nice place to work
Oh
Yeah.
because I get to learn a lot and having to be in code situations now, more confident. I can actually be in the code and say yes, I can do something there. So that the cardiac ICU has given me that opportunity and seeing a lot of heart readings. Oh my god, from VTAC to
Oh my god,
BP to
EKGs.
FCT to this to that.
Heart blocks, the different heart blocks.
The different heart blocks.
That's
Now I
fun.
see a whole lot of them. I'm
Second
like,
degree. I
okay.
still don't even
I
understand.
know, I get so stressed. I'm like, I know it's not good.
Third degree heart block. We see that a lot. Not good, not good. We either put
Call a rapid.
Pacing.
a pace
Pacemaker.
a temporary pacemaker, take them in for a permanent pacemaker, or just do the
Yeah.
pacing. But of course, not good. Not good. We don't want to leave them with a heart rate of 30. We don't do that on my floor. Maybe on Maura's floor.
No.
This floor.
No.
Just kidding. We don't do that to our patient.
Yeah, no, we
But yeah.
definitely.
Yeah.
But yeah, so if you're considering either ICU or PACU, definitely think about it, research on it. And there's this saying, they say ICU, PACU is where ICU nurses go to die.
No.
So
That's not true.
but
That is not true.
A lot of PACU nurses are former ICU nurses, like
Yeah.
Maura. So it's like PACU it's very interesting, and you still get that critical care. So
Yeah,
if
you
it's
do, for
something
sure.
where you want a well balanced work life, but you still want to experience that critical care thinking, I would say PACU is definitely where to go.
For sure. I've heard a lot of good stuff about PACU. Now, I'm not trying to sell you the PACU, but I'm trying to sell the cardiac ICU. But for real, the PACU is a pretty chill place where you get to learn and you have a balance, work-life balance. Things are pretty steady there, not, jumping to get one patient, another new admission is coming at the same time, or then you have the fear of getting tripled. Not necessarily in the PACU. But the only issue I have with the PACU, it's really cold in the PACU. It's
Oh my
so
god, it's
cold
so
in the PACU.
freezing.
Yeah.
It's so
wow.
cold there. You need
Why?
like 3 jackets. I don't know.
Why?
Especially since our patients come out cold. Like we have to like
Yeah,
read
like,
them
what's
anyways.
No, it's
I
cold.
don't
I remember
know.
when I did my first
Oh.
clinical day when I was in
Yeah,
nursing
it's
school. I was like,
freezing.
oh my god, is this how you guys survive?
It is
It's not for
freezing.
me then.
But I will say, starting in an ICU, because I know in nursing school they tell everyone, start in a med surg, start in a PCU, because you'll learn time management or whatever. I personally think that's such BS. Like, starting in an ICU, you will learn so much more than a PCU, because in a PCU, or in med surg, you're so task oriented where you just have a list of things to do. You don't get the time to dive into your patient's pathophysiology. You don't get to understand all the concepts around what you're doing and why you're doing. Whereas in an ICU, when you have that 2-to-1 ratio, you can take the time to say, okay, I want to make sure I actually understand what's going on and why I'm doing something, if that makes sense.
Oh, yeah.
So I don't know. I'm personally very, very happy I started in ICU.
Me too.
I can see myself going back into an ICU, but yeah, I think starting in ICU, if that's what you love and that's what you think you would really enjoy, don't let someone try to talk you out of that. Go for it, 100%.
Don't let them bully you into going to med surg and finding PCU.
No,
you don't have to.
God bless med surg and PCU nurses, though.
Yeah,
you
no,
guys
it's
do
not for
things
me.
that like
No
no one else
super-
could do. Yeah.
They're the unsung heroes of the hospital.
Yeah,
for
they
sure.
are.
Because as much as, if not for the ratios, honestly, med surg and PCU should not be as difficult as it is. But I guess because of all the
They're
extra,
overworked.
yeah, they're overworked, and they don't even get paid any extra. Then, so it's like, why would you take 6 patients when you can get 2? So it's just that balance of, okay, I really need to get a better work-life balance for myself, and that's why most people would rather start in the ICU now, which I definitely agree with. I didn't start in med surg, and I don't think you have to if you don't want to. So.
Yeah, because I definitely noticed when I was working PCU, I had a girl who's a new grad precepting with me, and there were times where I wanted to explain something to her, but I literally like did not have the time. And like it wasn't like I wanted to dive into like the pathophysiology, like, okay, so they have this going on and this are their labs, so what does that tell us? What do we need to do? But I'd be like, we literally don't have time to go over this right now. Like, I will make a note and we'll talk about it at the end of shift, and we'll just stay over because we got to go do the next thing, because half of our meds are about to be late because I have 6 patients.
In the meds, the med list for this patient, 22 medicine.
Yeah.
All kinds of medicine.
And good luck if they can't swallow.
I was about to say, because
And
I
it
got
will
a lot of
squish.
trach vent patients
yeah.
because I had the competencies to take care of them, and yeah, it was. Those PCU months were very hard on me. So, like I said, God bless.
God bless all
God
the
bless
nurses
all
and the
the
PCU and the
med
med
surg,
because if
long-term
everyone goes to
care.
the ICU,
Long-term care.
Yeah,
what's gonna be in the med surg if everyone is in the
Yeah.
ICU?
Exactly.
We really do appreciate you guys, and thank you for choosing med surg and PCU.
Yeah.
If that's still something that you want to, please look for a hospital that would not overwork their med surg and PCU patients. Yeah, there are hospitals out there that their ratios are a little bit better. So if med surg is something that you feel like that's something you want to do, definitely go for it. We're not saying that everybody has to be in the ICU, but please don't go to a unit where you're having 8 patients.
Because your license comes first.
Yes.
Because if you lose your license, you no longer have a career.
Absolutely.
So you protect your license first.
Yes. You can't be in 8 places at once.
Yep.
So please.
For sure.
So what would you guys say your satisfaction ratings on your current floor, Teni?
I would say right now, I'm currently at an 8. Compared to my previous unit, I was probably at a 6, because on this new unit, as much as I love the workflow and I guess I feel like I'm learning something on this new unit, because it's a new unit. I've never taken care of neuro patients. I would say the neuro is very demanding. Like, these patients can decline quick. So I guess for me, it's just like having to be on top of their assessments. That's the only part I'm like, okay, I'm still trying to get used to. But I would say it's great. I have great coworkers. The acuity is just enough where I'm learning something, but I don't feel overwhelmed. And also, the patients for neuro, sometimes for some reason, they don't seem to get better, because, like I said, the brain is very fragile. And once the brain injury is so severe, unfortunately, they can't recover. So those cases are the ones that are hard to deal with. And that's why I'm still like, trying to get used to this new unit that I'm on. But apart from that, I love it. 8 out of 10 for me.
8 out of 10, that's a huge number. How about you, Maura?
I would say 9 out of 10.
Okay.
Go PACU.
And I think it'll be a 10 out of 10 as I become more comfortable on my unit. Because in a medical ICU, I never dealt with anything cardiac, you know what I mean?
Oh,
Or at least to the level that we see. Same with vascular. Like, I didn't become stroke certified until I came onto the PACU. So I still think there are a lot, like, little nuances I have to learn. And just for that reason, sometimes at work, and it is okay, it is better to say I don't understand or I need someone to show me than to pretend you do. Don't ever do that. But yeah, definitely a 9 out of 10. I love it. I love my work. I love my coworkers. Just, it's a blast.
Oh, love
Good. I'd say for me, just because of the reason I switched unit was aside from the burnout, I wanted to acquire more skills. I wanted to be proficient with my skills, just because, like I said, I have a huge career plan ahead of me, and so having to run those big machines now, CRT,
Mm-hmm.
cardiac sun, swan, and all that, I would say it gives me a 9 out of 10 because what I'm looking for, I'm getting it.
Yeah.
And the only one left is because, of course, it's overwhelming sometimes. I can't take that out of it, but I enjoy what I'm doing. I'm learning, I'm growing, and that's the big thing for me. So I'm getting it where I am right now, supportive coworker, supportive management. So I'll give them a 9. I'll give myself a 9 out of 10. So we'll see if it's gonna be a 10 out of 10 soon. But for now, I'm not like competing with the packing nurse, but I'm saying it's still a nine
I
out of
know.
10. And FYI, guys, well, we all work under the same umbrella, the CBI,
Yeah.
Cardiovascular
Cardiovascular
Institute.
Institute of the
Yes.
hospital. So
Mhm.
we're kind of like,
Yeah, we're connected.
buddies,
Mhm.
bodies apart. So yeah, cool.
But yeah.
So that's a little interesting stuff about what we do every day. As a nurse, there's so many things you can do. If
Mm.
you're getting so tired of one thing, I mean, the sky they say is
It's
You're
big
loving it.
enough
it's
for
big
the
enough. Yeah,
birds.
it's big enough. So in nursing, it's a big field. So if you're tired of doing something, even if you're tired of bedside, you can do something else entirely.
Yeah.
You can go into informatics or
Oh
even
yes.
case management or even home health, where you
Oh,
can have one patient and just go to their home, take care of them and things like that.
yeah.
So nursing for sure, I would recommend if you have a passion for healthcare and if you have a passion for taking care of people or just doing something related to healthcare. It is a big field, and I'm sure my colleagues here agree with me on
Oh
that.
yes. So
Yeah.
many different things. So you don't have to leave nursing completely if you're starting to feel burnout. There's
Mhm.
the world's your oyster with nursing.
Like that.
And also you're not a tree, you're not planted anywhere. You can
I'm
always move
pescatarian,
and
sorry.
just move around. You can even be working in corporate as a nurse. You can be an
Yeah.
occupational health nurse. So many different opportunities that nursing have given a lot of people. You can do travel nursing, flight nursing, so many
Yes.
different things
Yeah.
with nursing. So
You can
nursing
be a
is
CNO. That's
people with
big
the
though, but
yeah would have the big bucks. But yes, nursing is, I would say, it's probably one of the best career fields and most versatile.
Most
So
versatile for sure.
yeah, so if you're looking into it, you don't have to be at the bedside. So please, we need more nurses. So
do you
Yeah.
regret being a nurse?
no,
Do you
no,
regret being a nurse?
There have been moments where I question my decision.
yeah, definitely on my bed.
But
Yeah.
no, I love being a nurse.
Sometimes I'm like, why did I
Why
pick
did I
this
pick this?
myself?
Especially in nursing school. In nursing school, there were so
Oh,
many times that I was like, nah, there's got to be better things out there.
And when I first started as well, because I was so overwhelmed, like, am I gonna ever make it in the ICU? But I can tell you, as time goes on, it gets better.
Yeah.
So if you're starting out as a new grad, don't get so overwhelmed. Don't beat yourself. Don't say this is the end of the road. Just think about it as you're growing. It's a phase of growth. Even nurses that have been nurses for 20 years, and some things they will learn in the day. I'm like, oh, I've never heard this before. It's new to me, and that's life in general. We learn every day. So being able to adapt to change and also learn, unlearn, it's gonna really help you in this field as well.
Well,
So
any nurse who says they know it all or thinks they know it all is a dangerous
oh yeah,
nurse.
danger zone, no
Yeah.
yeah, like
jumpa.
Yes.
yeah,
We're
run.
all always learning. We all have our own specialties.
Mm, absolutely.
Mm-hmm.
That's true.
But yes,
So we recommend nursing for sure.
yes.
I'll recommend nursing on a scale of 7 out of 10.
A 7 out of 10? That seems kind of low.
Yes.
Okay, I give
Okay,
the number.
okay,
Give
no.
the number.
I would give it an 8.5 for nursing.
Ooh.
Yes.
I'll give it an 8. It would be higher if we got paid more.
Oh yes,
True.
that
And we
part.
don't get paid more. Everyone that say you're enough to make a lot of money.
No.
Be quiet.
That was
We
during
do
COVID,
not.
and it was the government that was giving the hospitals the money. So please stop. It was the
Okay,
travel
now my
nurses
friend
that
is
were
like,
getting the
she's
money.
so mad.
Yeah, because me, I didn't get any of the money. The government was bailing out hospitals because they were overwhelmed, with the system. So they
Yeah.
gave them money so they could hire more people. But the money is gone. Please, the money is not there anymore. It's only travel nurses that made that money. So now we don't have any money. Please. Thank
Yeah.
you.
For the amount of work we do, we don't definitely the ratio is not balanced. The money we get paid and the work we get done, it's not. And
Yes.
people
Yeah.
say that you're not there for the money, but the truth is, if you don't get money,
Well,
what do you want? If you don't
how
have
are you
money,
supposed to
what are you
live?
gonna do?
Exactly.
Yeah.
So
How are you
how do you
supposed to support
survive in this
yourself?
economy, in this Joe Biden economy?
Okay,
You best
girl.
in this economy.
In this recession.
Please, you need money,
Yeah, we
please.
gotta take care of
Don't let
ourselves. We
anyone
have bills
deceive
to
you.
pay, and those bills will not wait for us. So
Mm-hmm.
definitely, so we kind of feel that pain. I wish the government would see this video and think about us, you know, people. And just pay us
Done.
more, please. We do a lot.
Mr. Biden, can you hear us?
But for real, on the more serious note, we do a lot, and we're so grateful we have to take care of people and we get the opportunity to take care of people. So we definitely love our patients and we like to care for them.
Yeah,
Yes.
for sure.
For sure.
But yes, so I think that's all that we have for you guys today. Thank you so much, Maura, for being with us. And Maura is our colleague. She's also a nurse, a registered nurse.
And
so
a friend.
yes, a friend
Thanks.
of ours.
She's my girl. I'm trying to bring her to Nigeria. So
Mercy.
our next video might be in Nigeria with Mara. So stay tuned. And
Exactly.
subscribe.
You never
Subscribe.
Stay tuned and see Oyinbo in Nigeria.
Oh, shit.
Oyinbo means like white person. So yeah, don't worry. It's not
Fun
a
fact, Mara's dad used to live in Nigeria, so she's
Yes.
quite familiar with a little bit about Nigeria, not a lot
Exactly.
because I kind of give her a little bit, but she knows something.
by association. At least
Yeah,
she-
by
she's- she's
association.
able to.
So yeah, it was
Yes,
nice having
come.
you again. We really do appreciate you
Yes.
coming on. to
Thanks,
this channel. Hope to
guys.
see you again
Thank
soon.
Yeah, bye
All
guys.
right, subscribe. Bye.